But we'll get back to the issue of donations and why we are at this rate as a country in terms of those that we've managed to vaccinate. Would you say that government is misguided on this decision to, lift COVID-19 restrictions? Would you say government was misguided?
Yeah, the minister was misguided by our technical team at the Ministry of Health. They didn't tell her the truth. Instead of them telling the truth, telling the minister the truth, they had to hide for them to protect their jobs, which should not be the case. And these are the people, I'm not shocked, because these are the same people who gave you unbid drugs. They are still there. They are still the one advising the current minister. So how do you expect them to advise the minister accordingly? Their aim is to kill the Zambians. And in the midst while we are anticipating the fourth wave, and the president, when he had the press briefing, he mentioned to say, we are anticipating the fourth wave and it will be more aggressive than all the waves that you have had before. Then someone goes and advises the minister to say, can you open the bucket of gas? What is that? That's now wanting to kill the Zambians. We don't know, we the Zambians, what we have done to the technical team at the Ministry of Health. We don't know, because these are the people who thinks always trying to kill us, the Zambians, but we always survive.
And but there's Mr. Roma, is a COVID-19 advisor at State House, who also, is of the same view that maybe when, they've been informed by science. The reason why there was lifting of this COVID-19 restrictions is because they've been informed by science. Are you also saying the president didn't get himself a good advisor to advise him on COVID-19?
You see, this is what we need to understand here. There's a theory component of viewing things and the practical component of viewing things. Unfortunately, most of the time, theories goes the opposite, but practical component goes also the opposite way. So for you to be good, you need to balance up theory and practical. In that way, then you'll be very good. In this situation, you are not supposed to imagine that this this is what can be done, or this. No. What you need to know is what has been happening in the previous, when the waves are starting. Which months in Zambia are we having worst cases of COVID? You discover that when it tends to be cold season, that's when we are having the worst cases of COVID in Zambia. And we are going in that period, which is the rain season that has everything there, the cold, the hot, and everything in it. And this is the season that we are going into. And when you check very well, you find that from there, we have been having some new waves, especially in the period from December, January, February, March, up to somewhere June, July. This is the period when it is more fertile for COVID in Zambia to go up. So how can you lift, or how can you advise the lifting of the suspension this time when we are going into that period? Already you have seen the rains have started. So meaning that we are going into that season of the numbers of COVID going up. This is the time. What I was anticipating was for everyone to push their energies in terms of wanting the population of Zambia to be vaccinated, not in trying to rush to lift the suspension. It is a popular move or a popular decision, but it is a wrong decision.
It's wrong. Do you say that this decision was not informed by science?
No. This decision has no science in it.
But look, if we look at the data that is coming through from the Ministry of Health, we're seeing the numbers getting to drop. The numbers of those that are dying, the numbers of those that are getting infected on a daily basis getting to drop. Isn't that science enough to tell us that, look, the COVID situation has reached a point where it's been managed a bit, and then so we need to lift the suspensions that we had closed up? Isn't that science enough, Mr. Kanyinka? Or perhaps maybe there's a lot of science that we don't know behind COVID-19.
You see, how many tests are you doing on a daily basis? 5,000 tests. The maximum you're going is about 6,000 tests. Test 100,000 for a continuous week, 100, and come back to me.
We have capacity to do that. To do that.
No, we are talking about science. We want new science, not on 5,000 people. Let's test 100,000. Let's test 200,000, and let's find out how many positive cases are we going to have. Then we can talk about that. Not on 5,000, not on 6,000. I've been talking all this time to say the number of tests that we have been doing is too small. So in terms of using the small scale, then you exaggerate to the entire population of 17 million. I think that's not good. It's like, look, we just test about, we do a random test of 200 people to test about HIV, or 100 people to test about HIV, depending with the area where we do the test from. Maybe that area is more prone to HIV or compared to other things. Then you test all the 100 tests, then all 100 tests comes out positive of HIV. Are you going to say the 17 million Zambians are positive of HIV? Is that science? No, it's not science.
It's an opinion poll.
You see, that's in short. You see, so
But
let's get to these factors.
Let's get to tomorrow. Is a very important day because we're relaunching, the vaccination program. All right, Mr. Roma, State House COVID-19 advisor to the president, did highlight that, look, we must get vaccinated. Very important that we need to get vaccinated. But he talked of the fact that the vaccination program we've been doing now has not yielded the results that we needed. Only 3.8, like you've put it, have so far vaccinated. What would you state led to low numbers in terms of vaccinations?
You see,
could it be blamed on government or the people?
Both, if I can say so. One,